Good evening, Facebook. Good evening, everyone. Good evening, Instagram. Good evening, YouTube, because this video is going across all my social media platforms. Hello, welcome to Divinely Classic. My name is Hebuwan Osarabo Esangbedo. So this is a very short video. It's the part 2 of the one I did earlier in the day about our medical quiz. So this is the answer session, and because I promised to do it, I had to do it because, as you can see, I'm so tired. So the answers to the question, remember the one we did earlier in the morning? The questions: question 1 was what is a thrombus? Question 2, what is an emboli? Question 3, what is an edema? Question 4, what is emesis? Question 5, what is hepatitis? And the last question, what is meningitis? So this is the answer session. And just to say thank you to everyone that has commented on Facebook, on YouTube, on Instagram. A lot of people went the extra mile, like really detailed definitions of this thing, and it's so appreciated. On Instagram, I think Sister Viola Austin, thank you for your answers. They were correct. Sister Omawumi on YouTube, Omawumi Folashade, thank you so much for your answers as well. Your answers were correct. And on YouTube, I also had Sister Uyo Agwam. Thank you so much for your answers. I'm glad that people are participating, because it just, you just want to like juggle your brain, do a bit of research. And the interesting thing about stuff like this is sometimes you know it, but you don't really know it, if you get my point. So just going the extra mile to search, to understand it. While you're searching, you are understanding what it means. So it's really good, this quiz. They look simple, but they actually help you to do more research. So the first answer is blood clots, like rightly said by everybody that's commented. So thrombus, the first question, the right answer, a thrombus is a blood clot, and it's a blood clot in the vascular system. And when we talk about vascular system, we're talking about the arteries, the veins, and the capillaries. But most times blood clots are likely to be in the arteries. Most times, yes, they might be in the veins, but they're likely to be in the arteries. And it is this blood clot that can cause a lot of medical conditions. A blood clot can cause stroke. Blood clot can cause a heart attack, because when there's that formation of blood clot, because it's mostly in the blood system, which is the vascular system. When it clogs a place, when it's too big to move past, it blocks blood flow, and that can cause a variety of medical conditions. So back to the answer. Question 1, a thrombus is a blood clot in the vascular system. Then question 2, what is an emboli? And thank you again for all who answered this correctly. An emboli is any foreign material. Sometimes people mistake emboli for just blood clots. No, I have seen a case where air was trapped in the vascular system. Air bolus, like a bolus of air was trapped, and that is an emboli. It's any foreign particle or any foreign material that moves within the blood. So it could be air, it could be blood clots, it could be plaque. And plaque is a formation of a lot of chemical processes, even the blood clots. And it could be air, like we said earlier. So an emboli, let me quickly say this, an emboli is the plural of embolus. So embolus is just a foreign material in the bloodstream, but emboli is a couple of materials, whether air, whether a blood clots, whether a plaque in the bloodstream. And when they move from one place, maybe from where they were formed to another area, that is what is called embolism. So embolism is the movement of an emboli, or rather of an embolus, from one area to another. And most times it will impede blood flow, because it will block an artery or vein or something. So it will reduce the blood flow that is going to different parts of the body. And a good example, like I said, is myocardial infarction. Another example of emboli is pulmonary embolism, where the blood, a clot or anything goes and block the arteries or the vascular system in the lungs. That will cause pulmonary sorry, I can't say my word right. Pulmonary embolism. And if that same blood clot or anything blocks, most times blood clot, if it blocks the cardiovascular system like the heart, it will cause a heart attack. And if that clot or plug or anything goes to block the brain, that is what causes a stroke. So embolus is not a good thing when you have particles flowing in the bloodstream that are not supposed to be there. So yeah, that's question 2. The answer is embolus. So question 3 is edema. What is edema? And the answer is, edema is the buildup of fluid in the tissues causing swelling. So it's the buildup of fluids, and a lot of things can cause edema. One, kidney failure. Another very common cause of edema is heart failure. You know, that's when somebody comes to the hospital and you're looking at their legs, looking at their body, and you see them swollen with fluid. First thing that comes to your heart, definitely an organ is malfunctioning, and more often than not, it might be the heart. When the heart is not, the heart is the pumping system of the body. When the heart is not able to pump blood around, the fluids that are in the blood now, they now begin to move from one space to the tissues. So they move from what they call interstitial cells into the tissues, and they become swollen. You see, like some actually sip fluids. Some people are so dermatitis that they sip fluid from their body. So that is what is called an edema. And if you have a situation like that, it's very important that you go to the hospital as soon as possible, because it could be a dysfunction of one of your vital organs. So that's the third answer. Edema means the buildup of fluid which causes swelling in the body. Good evening, Adibanja Merisho. Thank you so much for being here. Thank you for your contribution earlier as well. So the fourth one is emesis. So what is emesis? Emesis is the action of vomiting. Simply put, emesis is vomit. A more detailed definition says emesis is the forceful ejection of gastric content through the mouth. I repeat, emesis is the forceful ejection of gastric content through the mouth. Basically, when people are going to be sick or when they want to vomit, most times they can't help it. They just say, oh, I feel sick, I'm going to be sick. And before you know it, it just comes up. That is emesis. And when patients come into hospital like that, one thing that you would give to them is what is called antiemesis. There are lots of medication that are antiemetic, like ondansetron, cyclizine. These are medication that would reduce the risk of vomiting for patients. So emesis is basically to vomit. And the fifth one is hepatitis. So hepatitis, as rightly said earlier, is the inflammation of the liver. Hepatitis is the inflammation of the liver, and a lot of people got that right. Omowumi Afolashade, thank you again for being here. Yes, I got your answers, and yes, they were all correct. Thank you so much. Hepatitis is the inflammation of the liver, and just to say that when you hear anything hepato, you're talking about liver. So, and when you see itis, like itis in the medical term, is inflammation. So it's just very simple. Hepatitis, hepatotitis. So basically inflammation of the liver. That's what it means. And when you hear hepatomegaly, enlarged liver, anything hepato has to do with the liver. So hepatitis is the inflammation of the liver. And the last one, because of time, the last one is called, or rather the last question is, what is meningitis? What does meningitis mean? Sometimes people come into hospital and they tell them, oh, I think you've got meningitis. What does it mean? And the correct answer is the inflammation of the tissues surrounding the brain and the spinal cord. Basically, the tissues surrounding the central nervous system. We know that the brain and the spinal cord are the central nervous system. And the actual tissue is called meninges. I hope I said that right. Meninges. And when that meninges gets inflamed, either through infection, and it could be bacteria, it could be viral, it could be any infection, then there is the inflammation of the meninges, which causes meningitis. And most times people, because it's in the brain, the brain and the spinal cord, one of the common symptoms is headache. You know, people keep complaining, oh, I have headache, I have headache, I have headache. It might be that you've got meningitis, and you know, if there's that persistent headache, it's advised that you go into the hospital to get it checked as soon as possible, so you don't get really poorly. Because anything that has to do with the brain, with the spinal cord, that's why it's called central. That's where the messages come from. Everything that we do is all coming from the central nervous system. We want to do it, but then messages have to come from the head, from the brain to our body to do these things. I'm moving my hands now. If God forbid the brain is not functioning properly, it will not be possible. So when you've got headache, I'm not saying headache is all headaches are caused by meningitis, but I'm just saying a common symptom of meningitis is headache. So if you've got a persistent headache, you know, go see your doctor, go see your GP and speak to them about it. So that is the end of this video. I don't want it to be too long. I'll just do a quick recap. Thrombus is a blood clot in the vascular system. Embola is any foreign material. It could be blood clots, it could be air, it could be plaque in the bloodstream that is moving with the blood. Then edema is the buildup of fluid, which causes swelling in the body. And then emesis is the action of vomiting. And then hepatitis is inflammation of the liver. Hepatitis is inflammation of the liver, and meningitis is inflammation of the tissues surrounding the brain and the spinal cord. Basically, meningitis is the inflammation of the meninges. Yeah, that is it. I hope you enjoyed this video. Please help me share. If you like content like this, please share, please comment, and I will see you when I see you. And tomorrow I'll be very busy. I will not do any. I might share my food meals, which I'm going to start again. Tomorrow is the 1st of March. I'm going to start sharing my meals again, but I'm not sure I'll do any video because I'm very busy. So I'll see you on Sunday after church when I do a live video, and I hope you have a good day. Ciao.